Hi, I'm Shiv Gaglani. Thanks for checking out the Raised Line interview series, in which me and my co-hosts, Dr. Rishi Desai and registered nurse Jana Emil, explore how to strengthen our healthcare system with some amazing leaders in medicine, technology, education, and government. And they have some great advice for people starting careers in healthcare as well. I hope you will watch these highlights and then go listen to the full podcast interview wherever you get your podcasts. Hi, I'm Shiv Gaglani, and today on Raised Line, I'm happy to be joined by Dr. Sophia Yen. Dr. Yen is one of the co-founders and CEO of Pandia Health, a one-stop shop for women's recurring medications, starting with birth control. She's also board certified in adolescent medicine with more than 20 years of experience in medicine, as well as a clinical associate professor of pediatrics in the Division of Adolescent Medicine at Stanford Medical School. So, Sophia, can you start by telling us a bit more about your background, how you got into medicine, and then specifically decided to focus on pediatrics?
I've wanted to be a physician since about fourth grade, and I loved that it was an excuse to buy stickers. So I would buy stickers not for myself, but for my future patients. And I couldn't buy just one sheet. I had to buy 3 sheets because it would be sad if, a patient took one sticker and there wasn't extra stickers for the next patient. So it was a great way to milk my parents for stickers. But the true, I think, calling was that I love people and I love science. And each person is a different story. Each person is a different challenge to help them optimize their health. And my mom was a nurse, and she said, don't be a nurse, be a doctor, because the nurses do all the scut work and the doctors get all the credit. So I was like, okay, I'll be a doctor. But my tip to people out there is if you're going to do just general primary care, don't be a doctor, be a nurse practitioner, because you can do everything a doctor does with less education and you're unionized. But if you want to be more specialty, then maybe go for the doctor.
I guess one question, given that you are a physician and you teach so many residents and medical students as well, what advice would you give to them about meeting the challenges that COVID has brought and beyond? And it could be around women's health, it could be in general.
I think that telemedicine is here to stay, and we need to know what are our limitations. As a physician, I've always been skeptical about telemedicine because it is so easy to do a telemedicine visit and say you covered everything, but you didn't. You didn't listen to the heart. You didn't look at the ears. You didn't really get a good look at their throat. You weren't able to do a sample. You didn't even get their vitals. If they have asthma, can you really listen to their lungs? And certainly the equipment is coming. And when that equipment is here, yes. But before then, we need to admit our limitations. One big problem with consumer-driven healthcare is Yelp and other reviews, right? Because those of us in medicine know sometimes you have to be the bad guy, right? And are you going to give me a 5 out of 5 Yelp review? No. And as a pediatrician, we see it all the time because we're like, no antibiotics for you. And you're like, but I want antibiotics. But 95% chance you got a virus. And so that is, I think, something we need to look at and tackle. And we see it both in person and also by telemed. But if the consumer is paying for that visit, they're going to expect results, and they get very upset if you don't give them what they want. But sometimes what you want is not in your best interest.
Thanks for watching this preview of Raised Line. To hear the full interview, check out all of our podcasts and subscribe to the series. Please go to osmosis.org/Raised Line podcast or listen wherever you get your podcasts.